name's Lauren Wheeler. I'm the Behavioral Health Supervisor for the Josephine Recovery Center and the Crisis Transitional Services Program. I've been with the Center for Healthcare Services for 4 years now. I'm representing CTS, which stands for Crisis Transitional Services. It is a temporary program to help clients who are coming out of crisis, be it the observation unit or the hospitals, helping them get stable. It's about a 3-month program. We help them get stable and then transfer them out to an ABH clinic. During the 3 months when a client is with the Crisis Transitional Services, what we work on is usually they have needs like housing, substance use, things like that. So we help try to get them more stable on medications. They'll meet with our doctor up here. Right now it's Dr. IT. And they'll work with the case manager. In 3 months, we reassess whether we feel that they are stable enough to transfer to an adult behavioral health clinic. If not, then we extend the program, and it's just kind of dependent on the client's needs at the time. Right now, we actually are fully staffed, so we have our 4 senior care managers who the client will be assigned to, one of them, and they work together. They each know different resources to help each other out. Then the client will also meet with Dr. IT for medication management purposes and symptom management purposes. We have our nurse and our front desk staff who are all very friendly and greet the client and help get them set up as well. So most of the time, consumers are in crisis or recently in crisis and coming out of the hospital, or sometimes we've had a few instances where they're calling the police a decent amount, but not actually making it to crisis, but we still go ahead and accept them in. But the major criteria is that they are either struggling with homelessness, substance abuse, having physical medical needs, or have a history of criminal justice involvement. The main referrals we get from other CHCS programs would be from our crisis observation unit and from our PIC team. The main goal of our program is to help clients get stable enough on meds and in their life domain functioning that they can transfer out to an adult behavioral health clinic with the Center for Healthcare Services. And so the end result of our program is that they do connect with an ABH clinic. And so we fill out the transition plan, and we email the ABH clinic, and we don't actually let go of the client until we have confirmation that they have connected with that care manager and that provider over there. As of right now, what happens is that the care manager will staff with myself, and we'll decide if the client is stable enough and ready. If we have determined that, then the care manager will prep the client. We'll fill out a transition form that we then email to the behavioral health supervisor at whatever clinic the client chooses to go to. And once we get confirmation that they've connected, then we can go ahead and discharge them from our program. Sometimes if there's difficulty connecting to the other clinic, then what we'll do is have the care manager reach out to a specific care manager or to the provider to ask about that process and see if we can help get them connected. If you would like to discuss referring a client to Crisis Transitional Services, you can contact me, Lauren Wheeler, directly at 210-261-3801. For questions or more information about the CTS program, you can call 210-261-3162. With CTS, there are no insurance requirements. We do accept people with no insurance or on Medicare or Medicaid. Our physical address is 711 East Josephine Street, San Antonio, Texas, 78208.